Hello, this is Dr. Kavian Milani from Milani MedSpa. Today I want to say a few words about testosterone. As men and women age from their 20s, 25, 30s, all the way to their 40s, 50s, 60s, and beyond, there is a significant decline in their testosterone. And testosterone is a really important hormone for maintenance of muscle mass, for maintenance of well-being in terms of body fat, in terms of metabolism, and it does help with energy, sex drive, libido, and a sense of well-being. And these declines are both noticeable in men and in women. That's why I recommend for my patients that hit 40 to come in for testing of testosterone. The testosterone can be tested in different ways, but my favorite way is by testing the saliva, because that gives me the most accurate reading at the 6 a.m. mark, which is really the baseline that I need to go by. Blood tests throughout the course of a day has some degree of oscillation and is not as reliable and or as accurate. And dry urine testing is, in my opinion, too expensive. It's unaffordable for many people. But the saliva is affordable, is doable, and can only be done a couple times a year, and it's very affordable therefore, and it gives us a lot of answers that we do want answers to. So, number one, testosterone as it begins to dip, small amount of replacement in the form of topical, subdermal, or troche is very beneficial. That could be used. The doses for men and for women are obviously different. There are really no side effects, and the whole idea of testosterone as a cause of cancer has now been debunked, correct? So even in the case of, for example, the prostate cancer, that has now been basically disavowed. So that's a very, very good thing. And I've had like a patient of mine that I can cite as an example, 70-some-year-old with history of prostate cancer, but out of the treatment now, and actually is on testosterone, doing a lot better. So in general, I do recommend that men and women at the range of 40, 50, and 60 come into the office and check their testosterone levels. I recommend the saliva testing, which I think is the most useful, affordable, and cost-effective way of going about this.